Hello.
Well, hello there. I know that face.
Mhm.
You're up on top, so it's a little different. Well, good morning, Dr. Rosensweet.
Good morning, Carolyn.
Good morning. Happy Merry Ho Ho Christmas Eve day to you and
Christmas.
everybody.
I
Huh?
love Christmas. I love Christmas.
Oh, I know. Me too. Very much so. I got the coolest things for my garden. They're beautiful. Can't believe I found them. Make me happy. So anyway, I have some questions for you. We're going to get started here. And again, as always, thank you so much for coming up and being a part of this. Love it. Um, Getting started with my first question, and it comes in saying, well, I'm saying that I, Carolyn, remember a long time back, you're making mention of television commercials. You and I were talking, and you had made mention of these commercials and the huge list of adverse effects that people can get when taking this or that. I mean, they come after the commercial, but they go on and on and on forever. So a woman wrote in that included with her hormone package, the leaflet said in big letters, warning, risk for possible dementia. And this was in her estrogen box, and it scared her very much so. So I was wondering if we can again elaborate on the good that estrogen does for us, and that, you know, much fear still exists out there.
Well, yeah, first to comment on those boxed warnings. I mean, I think those television shows commercials are just hilarious.
I
This,
agree, and
this, this medication is going to be really terrific for you, but just look out. You might drop dead. You may have your head fall off, et cetera, et cetera, et cetera.
Daryl and I always like, cause he loves to mute them, and I'm like, no, I want to see these. These are hilarious, you know.
And the interesting thing is, in the world of pharmaceutical medications, what they have developed primarily is a whole host of very strong medicines.
Mm-hmm.
And in many cases, when diseases have progressed too far, strong medicines are there to rescue as an emergency. And so you don't want to just discount that at times people to stay alive need some really drastic measures or intense measures or strong measures. And when you're using something strong in the human body, it can have other effects than the primary intended effects. And when you're using something strong, sometimes those effects can be harsh. So, you know, I just think it's hilarious how they do it on TV. I think if there was some kind of simple approach to a physician or someone in a physician's office saying, look, this is strong medicine. This is how far your health has gone. We really want to use this as a temporary measure to roll back the severity. And we really want you to get down to figuring out what the causes are so you can reverse this, so you can heal. I know I'm drifting a little bit there. Now, I'm not sure the question that you're asking. You're talking about a boxed warning or a warning that's given to the patients with each prescription.
Yes,
and,
so opened it.
I'm surprised. I know the compounding pharmacies are not uniform in issuing these kind of severe warnings about what they're dispensing. And I don't know.
That's a pretty severe one. You know, warning, risk for probable, not possible, probable dementia.
And yeah, I'm sort of curious, did that come in with a compounded hormone prescription?
Yeah.
But I don't want to try and figure it out. Here's what I would like to say. This is wrong. This is horrible and wrong information. Because, for one thing, if you're using compounded bioidentical hormones, the only thing that you're actually doing is replenishing what the woman's body needs, and really needs, and I mean really needs. I don't mean maybe needs, I mean really needs. And yes, mistakes can be made. Hormones are very powerful, and some of the methods of dispensing these, I take great issue with. I think they're improper, only in the best of the most experienced hands, but so many mistakes are made with many of the methods of administration. And so many administrators are not experienced enough, and they don't know what they don't know, and they're not specializing in menopause. And you can make the error of too little, in which case a woman is eventually going to lose her, get osteoporosis, most likely, and sarcopenia, lose her muscles, not have enough to take care of her arteries, not have enough to take care of her brain. So that's from too little. That's not from the hormones. And then there's always, anytime you're using powerful biochemicals, your body puts out the right amount most of the time, unless you're stressed, in which case it's going to put out some extra estrogen. You're going to get into problems with that.
Yes.
Like, period cramps and endometriosis, etc. But in general, one of the major purposes in the method that we teach and administer is don't do too much. These hormones are too powerful. Don't give too much. And, I could get specific someday if someone asked me about, well, what happens when you do too much? Well, I would isolate out the individual hormones, and I'll tell you what happens. You just want to get it right. And menopausal women do not, NOT, need youthful levels of hormones. In fact, we make a strong case that we come shy of youthful levels, and you'll get every job that you want done really well. Now, the crazy thing is, funny use of the word, is a lot of women who get diminished estrogen get cognitive challenge.
Yes.
And it's a very common complaint on the first visit, and it's women say, I'm not remembering things, my brain isn't thinking as clearly, the sentences aren't coming out as clear, there's some kind of gap between my neurons and my thoughts and my speaking. And that's the beginning of things. And then there's a very significant number of women that over time will get cognitive decline that's really troublesome, or a cognitive decline that's disabling, or a cognitive decline that you could start classifying as dementia, even Alzheimer's. And, this is from insufficient estrogen. And sometimes, and this is the exception that I really agree with, is, and I'm going to tell you a story that I've told before. I'm sitting down at the National Academy of Science about to be a presenter to them. And there's 3 other people on my panel. And I've done some research on who else is going to be on the same panel I'm on.
Right.
And I learned that one of the doctors is on a hormone program that recommends very high dosages of hormones. Dosages so high that the period is sustained or restored. And I know that this is a bugaboo for a lot of the traditional doctors, restoring the period, and there's good reasons why it's a bugaboo for them.
And she was an older woman. I mean, she wasn't in her 30s or 20s.
No, she wasn't. She was 65 when I met her.
Got it.
And it's a big bugaboo, and there's reasons why it's a big bugaboo, and it puts bioidentical hormone prescription in general in jeopardy. And that matters to me a lot. And so as she's sitting down, taking her seat, we're about to present in 2 minutes. She's taking her seat. She introduces herself to me and smiles. And I say, are you going to tell them that you're on this certain prescribing method? And she looks at me and she winks her eye and she says, no, not going to reveal it. She knows it's a problem for them.
Right.
I went out to lunch with this physician, and she's 65. And she said when she was in her early 50s, she started to notice that she was having trouble thinking. And it really concerned her because her mother had actual dementia.
Uh-oh.
Her mother's sister, her aunt, had actual dementia. And she knew enough to know that she could be headed on a freight train to dementia. And she started taking estrogen, and she kept on increasing the dose until her mind cleared up. And lo and behold, her period returned. She was on really high dosages. And, I was so touched that she cleared up. And here she is, 65 years old. She's practicing. She's dynamic. She's clear as a bell. So you never say never. So even though these are not NOT, the dosages that we recommend, we advise against dosages so intense that you sustain a period or you get your period back. Just so you know, when we test a woman who's been able to restore her period, she has 3 to 8 times the upper limit of normal, 3 to 8 times the upper limit of normal of estrogens and hormones that a young woman has. This is not just merely sustaining youthful levels of hormones. No, it takes a heck of a lot more. There's more to a period than hormone levels. And to get one back or to keep one going, you need 3 to 8 times the upper limit of normal of a young woman. And as I was having lunch with this lovely doctor and her son, I didn't say boo. I said, it's a miracle. And so that you never say never in medicine. There's always exceptions. The benefits for her so far outweigh the risks. So I drifted away because this woman, this question you're asking reports, don't take this, you can get dementia. I've never heard of that.
Well, that's a little weird.
You get dementia from taking these hormones. And I take great issue with that and challenge that greatly. And I would like to say that the lack of estrogen in certain susceptible women can lead to severe cognitive decline, even dementia, even Alzheimer's. So this is a no fool around thing. And it's, it's crazy what they put that in a package insert, especially a compounding pharmacy.
Yeah, absolutely. And it got me to thinking about you and how you had smelled what was inside of that jar that one time. And then also, what Dr.
That's a different issue, Carolyn. That's
sorry.
not what I'm talking about.
No.
That's totally different.
No, I understand. I just let my mind wander a little bit in regards to hormones and having them come and being sold, and then having something in a leaflet stating what it did. And I apologize that I got off track a little bit. I had, in reading Dr. Blooming's book, it's something that he brings up at the beginning with his wife, who was an avid reader and loved to do crosswords. And she was having a very hard time remembering cognitively what she had just read and her crossword puzzles. And she was treated with estrogen and she did get better. So that's not off track, right?
That's correct.
I stayed on track on that one. But yeah, and I treated a woman too. I was like her, I drive her around, and she was a doctor, a psychoanalyst. And now that I look back 30 years, I betcha that her hormones were off. And it was very sad because nobody caught that. And she had to stop being a doctor because she couldn't remember her math. And I don't know what became of that. But estrogen, as you say, is important. Yes?
Well, yes.
Yes. Yeah. Thank you for that. I would be very frightened if I received a warning like that.
Yeah.
As an insert to my package. And I'm glad that this woman asked the question, and I appreciate that you answered it.
And you know what else, Carolyn? Is one of the complaints of the NASEN committee was that the bioidenticals didn't have these boxed warnings that the pharmaceutically manufactured drugs do have. And the boxed warnings that are with the pharmaceutical medications are very frightening. And what they say is, what the box warning means is that the very top of a patient insert, there's a box and it has the severe warnings.
Right.
And the box warnings for estrogen still say you're an increased risk for breast cancer, heart attack, and stroke.
Yes.
And this is very deleterious. It scares women. It has a tremendously adverse effect on women. And it's not accurate, as you, as much as anyone, know so well, that the opposite is true, that women who are being treated with hormones are at less risk for breast cancer, heart attack, and stroke than women who go untreated. And, this wrong information slipped into the general consciousness in 2002 with the publication of the Women's Health Initiative.
Yes.
It was wrong in the beginning. It was not statistically significant. And the very same investigating committee that published that original Women's Health Initiative published in 2017 that after 18 years of follow-up, there was no increased risk.
Right.
It was wrong in the beginning. And so, it's in the boxed warning still. And so here's what's going on. A woman opens up her pharmaceutically manufactured hormone, whatever that is, sees the warning, and she's taking the hormones every day. Well, this is not the kind of thing that I call good medicine. Prescribe something that at the same time the woman reads that, well, I could be getting breast cancer if I do this, or a heart attack or stroke or dementia, as you mentioned in your question. This is bad medicine, especially when it's a lie, especially when it's scientifically false. But to do that with anyone, if you're going to give someone a medicine, you want to say, look, these things are strong. They can have adverse effects if maladministered. And at the same time, you need this. This is going to be good for you. This is going to help you. This is going to help you a great deal. You don't say, I'm going to give you this, but you can get breast cancer, which is false.
By the way,
so, big topic. I mean, all these are big topics.
Yes, they are. And thank you, God, for you, because you have really helped to dispel so many of the myths that are out there. And it is greatly appreciated. There is and continues to be a lot of confusion. There was another question that came up. It wasn't even a question. It was a statement that just said, I am well aware that 80% plus of women get breast cancer from,
And you know what? Instead of going on with the questions we've asked, there's been some very interesting questions that have popped up.
I see that.
Chat, and I would like to shift to those questions.
Please, by all means.
Yeah, would you ask? Would you sort of? And I'm going to have to ask Andre how to scroll this.
Yeah, because I don't know why it is on my computer I cannot scroll. I've got Joanne. So this one came up. She said, what we were talking about came up in another group last night. I just want to touch on it. I'm not questioning the poster at all. It was her journey with breast cancer at 35 due to low estrogen. I didn't think low estrogen could cause breast cancer, but unbalanced and higher estrogen levels. It kind of fires the group up because she said that, that was what I just said, but it wasn't the same. I'm not sure if it was the same woman. She said that 80 plus of men or women get breast cancer. And I, meaning Joanne, was intrigued about low estrogen causing cancer.
And I just learned how to answer the questions. And if you look on your screen, Carolyn, you can see we can scroll. And
in the weirdest way, I just don't have a cursor that allows me to do that.
Well, I'll move them.
Thank you.
Now, Joanne, 80 plus.
Yeah, it's what I just said.
Women. Let me see if I can get this up on the screen even, because I came up in another. For one thing, cancer. This can occur in, I mean, whenever we hear that word, for good reason, we're concerned about it, and it's serious.
Absolutely.
And some cancers are easily treatable. And one of them is breast cancer caught early.
Mm-hmm.
Easy to treat it with an extremely high cure rate. Oh my God, well up into the 90+%. And so are skin cancers and other cancers when detected early. And then some cancers are very, very rough, and especially when you catch them late. And breast cancer is one of those when you catch it late. And it threatens our life, and we could leave the planet Earth because of these. And how I like to explain it to patients is, let's pretend on my back wall here, I'm going to show you a video of your whole life.
Right.
That we're going to have a videographer film you from the time you're conceived till right now in this moment. And we're going to put it on a computer, and we're going to press a magic button on the computer that eliminates all the good stuff, all the happiness, all the health habits that you had that were beneficial, all the good food you ate, all the good exercise you did, all the love you experienced, how skillful you were at handling the stresses of life and growing from them. We're going to eliminate all the good stuff. And what's going to be left behind on this video I'm going to show you on my wall here is everything that wasn't okay. All the marginal food you ate, all the toxic exposure you had, all the unbeneficial and negative thoughts and uncomfortable feelings that you didn't do the right thing with, and etc. All the actual causes of illness. And what we're going to see over the course of your lifetime is how you compromised your immune system, how you develop trouble, and how cancer cells, which are present in us, you couldn't control, how it got out of control. There's specific reasons. There is not a disease that is life-threatening that is caused by low estrogen, or for that matter, high estrogen, or for that matter, by any hormone in male or females. The causes of these illnesses are far more complex, and there's thousands of moving parts that have taken place over the course of your whole lifetime. And I'd like to add to that list, sometimes the causes of illnesses are not understandable, and you don't find the reason for them. And it takes, there's a book out there called The Gift That Nobody Wants. And its other title is Remarkable Recovery. And these are a compilation of stories of people who have had life-threatening illnesses, and they healed them. And that's another thing I'd like to say is healing's possible. It doesn't matter what diagnosis you have.
It's so true.
There hasn't been someone on the earth who hasn't healed this specific diagnosis you have. And the thing is, back to your question, there isn't anything caused by low estrogen other than menopausal symptoms, and a whole host of them, or high estrogen for that matters. Now, so you've got to get over this single concept that a natural hormone inside your body is going to cause cancer. Now, there is a fine-tuning thing here. Women who excrete excessive estrogen throughout their life, or for a period of time in their life, very often do so because they're not only using adrenaline and cortisol for the biological stress response, they're recruiting other powerful and useful hormones.
Right.
And they can get increased amount of estrogen production because estrogen does function in promoting and assisting the biology of the fight or flight response.
Right.
If a young woman keeps excreting excessive estrogen, and especially when it's not balanced by progesterone, she's going to get excessive effects from estrogen. One of those effects are going to be overstimulation of the uterus. She's going to get cramps. It can even go so far is to squirt some of the endometrial lining not out the vagina, but up back into the tubes. And get endometriosis, and this is really problematic. And this is from excessive tension and excessive estrogen production as part of what the mechanism is there.
Right.
And then she can overstimulate breast glandular cells. And when you overstimulate them, you get breast glandular cell proliferation that leads to something called increased breast density. This is not a healthy breast situation. The circulation of the blood and the lymphatics, lymphatic drainage is harder through a fibrocystic or an increased breast density. And when you couple that with brasiers, which as much as people are attached to them, they're not healthy.
Well, especially the underwire ones.
Correct. The compression bras and the underwire bras, they're blocking lymphatic drainage of metabolically intense byproducts that your body wants to eliminate. But if you're putting pressure on the lymphatic channels, you're going to interfere with that drainage. So the exception I would say is that excessive estrogen and estrogen dominance can lead to excessive breast glandular tissue and breast density, and that is a risk factor. It's an unhealthy breast, and women that we work with, we keep working until we get that breast as healthy as possible. And there's many steps that you can take, and I'd like to mention them.
Okay.
Women who have increased breast density. I know it's a sidebar, but why not say something useful rather than just theoretical? Women, think in terms of less brassiere wearing. And also think in terms, there's medical studies out there that are readily available that show that in cultures where bras are not used, there's a significantly less incidence of breast cancer. Think of less bra wearing. Think of eliminating these underwire bras and these compression bras entirely. They are not okay.
Not ideal.
Yep. They're not okay. They're not healthy. For some women who don't have excessively large or increased breast density, they're reasonable. Breast movement, as in jogging without a brassiere, is very healthy. This has adds to circulation and adds to
Interesting.
So diet plays a role here. Excessive caffeine can be a problem. So I just want to introduce you to a sidebar there about, because you're making the comment due to low estrogen. No. And due to higher estrogen imbalance, no, that's not going to cause cancer, but it can cause an unhealthy breast.
She says, free the boobies.
Exactly.
Reminds me of Gloria Steinem.
Simple question there. Not so simple answer.
No, not at all. And back in my day, as kids, they were the best thing going, underwire bras. We just thought they were fabulous, for a multitude of reasons. Nobody told us,
Yes. So
couple that with the birth control pill, and it kind of made like a perfect storm, at least in my case. So yeah, that word breast cancer and hormones continues to be. May I throw in my one of my other questions before you get to the other questions?
Yeah.
Okay. I think that this is important. Yeah, that one's a long one. So this I want to ask quickly. Can you please explain again why it is that we need to stop hormones for a few days per month? There's a lot of going back and forth in regards to that statement. Do we stop taking hormones, or do we not stop taking hormones? Do we stop or do we not stop?
Here's the purpose. It's an interesting technique to prevent excessive amount of hormones accumulating over time.
Yes.
These hormones, all the ovarian hormones, are fat soluble.
Mm-hmm.
That means they accumulate in the fat. And just like if you take an excessive amount of vitamin D, or vitamin A, for example, it's going to accumulate in the fat. People who take an excessive amount of vitamin A get yellow skin because vitamin A is yellow.
Right.
And because they'll accumulate in the fat. Well, the hormones will do that as well. Now, women who are on too low of dose are not going to get excessive accumulation.
Right.
Women who are on the perfect dose are not going to accumulate hormones. Women who are on excessive doses are going to accumulate hormones. Women who are on minimally excessive doses that they can't detect, that aren't enough to produce overdose symptoms, such as increased breast tenderness from excessive estrogen,
Right.
say that they're just on a minimal amount of excessive estrogen, not enough to overstimulate breast glandular tissue and produce breast tenderness.
Right.
But if they're on 10 extra molecules, gradually over time, 10 molecules more than what they need, gradually over time, they're going to accumulate excessive estrogen in their body.
Right.
So what we do this trick called stop taking your hormones once a month. And it's not 100% scientifically precise, but let me tell you how we do it. On the first day of the month, just because it's easy to remember, we say to our patients, stop taking all your hormones and let's wait and see what happens. And in many women, not all women, many women, they're going to do fine on the first day because they still got hormones in their body. It's in the fat and it's going to come out of the fat. The fat, in this case, is a strategic reserve to release these hormones. So let's say on day one of elimination of the hormones, they don't get a symptom at all. And on day two, oh my, they don't have a symptom at all. They feel fine. And on day three, they get a hot flash. Here's what we learned. Somewhere between day 2 and day 3, their hormone levels dropped so low that they were taking care of any overaccumulation. That's for sure.
That's for sure. Yeah.
In fact, they went too low.
Right.
What we advise from that point on is every month stop for 2 days, not for 3 days. We don't need you to get the hot flash. In fact, it's not a great thing to trigger there.
No.
I'm getting a message here, so I'm going to click on that and excuse me.
Okay.
See if I can eliminate the message here. I said, well, Krishna, we thank you for the Merry Christmas, and
yes,
we don't know how to remove this question, and we thank you, Krishna, again. Hello to you.
Definitely.
So when we do that once a month stoppage, we are ensuring that over the long run, a woman is not accumulating excessive hormones. And let's say a woman stops for 1 day and she immediately gets a hot flash. What do we learn about that woman? She's not on enough dosage. And we don't want her to stop once a month. In fact, we want to adjust her dosage and also eventually test her with 24-hour urine hormone testing only. And so we want to get that right so that she's in the optimal zone. And that's one of the tricks we use to prevent accumulation of excessive fat-soluble steroid hormones in the fat tissue over the course of time. That's the answer.
Got it all written down. Definitely. And that can be found in the book. And it's a really great chapter in your book, Happy Healthy Hormones, on dosing. And I love that chapter because, one would think kind of easy. And again, as I always say to you, you don't miss a beat, and you didn't, and you don't, and you did not. And again, that chapter is excellent because it does teach you how to well dose and why, and about titration and so on and so forth, which then I believe at any rate enables us to somewhat, certainly working with our doctor, but to take our menopause into our own hands, in a way, which to me is a wonderful thing. Yeah, for sure. So I want to get to this other question as well, and then get to these. You know, I'm off all day. I don't know if you have a hard stop today, but
I do.
okay. Surprise, surprise. A woman has been taking hormones now for 3 weeks, and she's continuing to feel absolutely miserable. And I had, this isn't a yes or no, but I had asked you in one of our first interviews, and I remember this clearly. I asked you the question as to why it is we could take a pain pill for a headache, the headache goes away, take maybe, tranquilizer, that anxiety goes away, and it happens pretty quickly. However, this is not the case with hormones, come to find for many of us. There are some really lucky women. They take hormones, no big deal. They live their lives happily ever after, and they're fine. For many of us, hormones take their good time to work. And I was wondering yet again why this is. Why does it take hormones so long to work?
Well, for one thing, like you just said, some women, and it's not very common, they're in the perimenopause, they're in menopause, early menopause. Their bodies are used to hormones, and you give them hormones and they feel better within a day or two. In fact, a pharmacist friend of mine told me that he was a prescriber, that when women came to their first consultation, and also a dear medical doctor colleague of mine did this, when the women would come for their first consultation, he would hand them a bottle of Abiast and have them put a couple drops on their wrist. And during the consultation, some of those women would feel better right then and there, right away. Now, I don't do this. This is very rare that someone's going to get that rapid results, but it is possible, and you don't want to leave that out. And some women within the first week or 2 weeks, they're starting these hormone programs and they're starting to feel better right away. It's fantastic.
Yes.
However, so many women don't have that experience, and it takes a while. And here's one of the reasons that I think it takes a while, is that very often women are starting these hormone treatments and they haven't had hormones for a month or 6 months or a year or 5 years. And what happens, their whole body adjusts to the less hormones. In fact, their body's been adjusting since they were 20.
Right.
At the age of 20, they had their most robust hormonal output, and it's been a decline ever since. And everything, the knee bone connect, everything compensates and everything adjusts, and it keeps on adjusting. And then they have that major droppage that occurs, and that it's dropped when there's no more period. The body adjusts to that. And part of that adjustment is hormones work with receptor sites. There's the hormone and there's the receptor site, and they get together and they do their thing together. And when you don't have hormones, the receptor sites go dormant.
Right, they go to sleep.
And it takes some time, if at all, that you're able to reawaken these receptor sites and make them physiologically active again. So much more common if a woman's gone a period of time without having hormones, it can take a while. And I say, I caution women, especially women who haven't seen hormones for a while, and that, give it time, give it a month or 2 or 3. And sometimes when there's been long periods of time,
yes,
I say, let's take the first year here. We're not expecting that you're going to have rapid results. We're just going to do it at a pace that your body can actually receive it. And if we go too aggressively, which is the temptation, hey, just give a heck of a lot more. We flood these receptor sites. They don't work at all.
Yeah, right.
So the art is connect up, go shopping. Like I've always said, your biggest job is to go shopping and find yourself an expert. Find someone who is dedicating their career to treating women in menopause with bioidentical hormones.
Yep.
they're going to have the basic knowledge, the training, the experience to be able to help you, guide you in this process at the proper rate and not overdo it with you.
Right. And so when that question comes in, and I'll use myself as an example. I remember I went 2 weeks. I felt great. I had not had hormones in my system for 17 years. And, it's quality versus quantity at that point for me. Oh my God, 2 weeks in and I was just elated. And then for whatever reason, something went weird. And I remember having this discussion with you post interview, and it was a meltdown for me, but it was beautiful because it really enabled me to understand what was going on, and that I had not seen hormones for so long, and that my receptors were not recepting, so to speak. I don't even know if that's a word, but they just weren't, and it would take time. And so just in my own case, it did take about 5 months, worth every minute of it. And now I'm going into year 3. So that's going to lead me really quickly into a very quick question. When we're making hormones on our own naturally, hormones fluctuate. I mean, they just do. And I've asked you this before, but just quick answer. If you're being given hormones, compounded bioidentical hormones, can they too fluctuate?
Well, the general idea is when a woman goes into perimenopause and menopause, her hormone levels decline. And the general idea, from my perspective, is bring those hormone levels up to reasonable and effective. The fluctuation you're talking about I believe, is the monthly fluctuation in how estrogen is secreted throughout a cycle, how progesterone is secreted out a cycle.
Yes.
That one, we do not try and replicate that. I ran the experiment of trying to replicate that. Good idea, fun theoretically, didn't work in menopausal women.
Got it.
And I take strong issue with those who are claiming that that's really important, to fluctuate just like nature does. We did it, we tested. It's a whole story. I'm not going to go into it right now. That's one fluctuation. There's another fluctuation that takes place with the stress response. So although I recommend daily, steady, consistent dosages of all these hormones.
Absolutely.
Once a month stoppage. And, sometimes a woman goes through a tremendously stressful period. And in that case, she starts getting symptoms of hot flashes on the same dose that she's on. Well, one of the things we do with the book is to help educate the women so that they have the ability to do a little fluctuating.
Yes.
So if a woman is going through a very stressful period and she's been doing wonderful, and then along comes the stress and she's starting to get warm rushes, I say, feel free. Go ahead, add an extra drop. Play with this. Because, Carolyn, like you're suggesting here, there is that stress fluctuation that can call for more, and then you want to fluctuate back. If you're going to increase your dosage, you want to go back when things calm down and you're recovering. And a quick break to talk about the fluctuation. If you'll see in my book, in a young menstruating woman, that, for example, it's just amazing how estrogen output and progesterone output occur over the course of a 28-day cycle.
Right.
When you're menstruating, the estrogen is very low. And then at the end of that menstruation, the estrogen rises into its highest peak around day 12. And then you ovulate. And then it takes quite a dip. And then it rises again for the rest of the cycle, not as high as it was, and then it gradually declines. That's a fluctuating estrogen output during the cycle. Yeah. And at one time, I had the idea, and so did someone else out there in the world, had the idea, why not copy nature? Why not administer to menopausal women just like nature does, and vary it? And I love math, and I love spreadsheets. And I gave women these dosage alterations, they're different dose that changed 4 times throughout a cycle to copy nature. And I have always had a very inspired, interested, intelligent demographic of women that I've worked with. So they got on it. They liked it.
Right.
They thought they liked the idea, and I asked them to do that. And then I see my patients annually. And here's what happened. I had most of my patients doing this, fluctuating doses. And at the end of on their 1-year follow-up, every single patient of mine that I had on that fluctuating program had gone back to steady daily dosages on their own. They were a little shy. Some of them were a little uncomfortable that they were reporting back to me that they didn't do the program, and they went back to steady dosing. And when I asked them, why did you do that? They said, because it just didn't work as well. I didn't like it, and I didn't feel as good. But when I got back on my steady dosages, I did. And of course, we were not trying to restore the period. We were just trying to copy in the dosages that were appropriate for menopause, the fluctuation. So nice idea. Not only that, I have a dear colleague, the father of who brought bioidentical hormones, one of the two, who brought them to the world, Dr. Jonathan Wright.
Yes.
He got very interested in this fluctuating way of administering, and he has a laboratory, 24-hour urine hormone laboratory, and he said, why don't we test these women? Let's test them 3 times during the cycle and see what's happening. And we did. And several of our patients decided they were willing to do that. And what we learned is that the lowest estrogen levels were on day 7. And the medium amount of estrogen levels were on day 12. They should have been the highest levels.
Right.
And the highest levels were on day 21. They should have been the medium amount. So what we learned is, the ovary does not function just like applying hormones to the skin. They're different things. And so,
maybe.
But by that time, I had learned woman by woman that it wasn't working anyway. So I'm not going to recommend that at all. I love steady doses, stopping once a month for the reason that we covered earlier. And now I want to, someone asked that segues beautifully into what I just described there, and it was the question about migraines.
Yeah.
And here it is. There are migraine and headaches and migraines have a multitude of causes, and young men get migraines, and it isn't from hormonal fluctuations. However, in young women, there is a certain a number of young women that have migraine headaches. And interestingly enough, they coordinate time-wise with their cycle. And interestingly enough, they happen at the time that the estrogen is falling. That's most common. In other words, when a woman in her cycle, her estrogen dips way too low.
But can that happen like very quickly in like a day's time, 2 days' time?
Oh yeah, it can. It can happen abruptly, and it's really a matter of her body doesn't have enough estrogen because it fell. And so when does that happen? That happens at the end of almost just before she menstruates, because that's when the estrogen cascades low. Right. And as I was describing earlier, it also happens mid-cycle. Day 12 is the highest amount, and it falls again and on day 12. Not as low as it does at the end, but it does fall. So some women get that migraine mid-cycle, and some women get it at the end of the cycle. And I'm telling you, if you're getting migraines and you're a woman, keep a diary and see when those migraines show up. And they're going to show up. If they show up mid-cycle or the end of the cycle, you need hormone support. And it's very important that you get it. And not only that, it's very effective. And God, you're going to love it. Now,
Got it.
not all migraines actually are related to estrogen and menstrual cycles. So I wouldn't want to, I wouldn't want to declare that they are. There you go.
Yeah. It's sad. I had a girlfriend who suffered horrible migraines for about 28 years. She got onto hormones and now she's much better. But 28 years, she really was so sick and she was in bed, and nobody really thought ever to think of hormones as a treatment for her. Finally, they did, and now she is much better. So are you saying that there's that ovulation period and then there is the time when you actually have the period? There are those 2 times during the month.
Yeah, the time just after ovulation and the time just before the period is a common, or during the period. That's when the estrogen cascades low. Some women, the proper treatment is getting those estrogen levels right. It'll alleviate the migraines. That's fun.
Yes, definitely. Yeah, I think that.
And to answer one little bit more about Erica's question.
Okay.
This is you asked, can you discuss hormones and migraine with aura? Is it safe? Well, I can't think of it being unsafe. However, migraines are intense and we don't want to mess with them and we don't want to worsen them. And I actually have, for the first time in my life, a patient who's in 60 who has migraines and hormones made her worse. Now, her migraines have a different origin. They have to do with her cervical spine has some major challenges there. But, here, what have I done? You've asked the questions about migraines, and I'm giving you an idea. But like anything in medicine, it's only a theory. The proof is in the pudding. Right. So I come up with this theory with my patient. You've got regular migraines that are occurring mid-cycle. Let's supplement and replenish just a little bit of estrogen. That's a theory. The proof's in the pudding, and everything's an experiment. And I'm aware that I could worsen a migraine by giving something so powerful as a hormone. I've only seen it happen once in my whole career, and it happened recently. But I'm now aware that I could worsen a migraine. So any of these things we approach cautiously. We don't flood anything. And it's a theory until it's proven to be effective.
Right.
And having said that, there's a lot of women who've had migraines alleviated by getting their estrogens right. It's a miracle when that happens.
Yes, absolutely. And that woman can feel it. Absolutely. And it feels like a miracle. It is a miracle. Oh my, yes, to go from feeling one way and then feeling another way and knowing that there is help and hope is just absolutely incredibly amazing. It is. I'm reading some of these other questions. From Levon, she says, can BHRT cause an increase in alt liver enzymes? I've been told 25 years ago that I have fatty liver, but never have had high liver enzymes until began BHRT, but I was also dehydrated before blood work, hoping that was cause and not BHRT cause, because I don't want to stop treatment.
Levon, it is very important that you get treatment from an expert, because what you are describing is possible. Like every single hormone that comes out of a young woman's ovary or a young man's testicles or other glands for that matter, the hormone is secreted into the bloodstream and goes to the cells and does its thing. And in the cells, it gets biochemically converted to something called metabolic byproducts. And also, this metabolic conversion can take place in The liver. The liver is the
Yeah.
final answer to the processing of these hormones.
Yeah.
And the flip side of that is we want a healthy liver to be able to dismantle biochemically and transform these hormones, among the many other things that the liver does.
Right.
And so fatty liver is a liver that's taken a hit. And like anything, anything's healable, but it very well could be that your liver just doesn't have the ability, and it's been compromised enough that when you take hormones, it's a challenge enough to your liver that it's raising your liver enzymes. So that's why I say you want an expert, and you want
Yes.
you want someone who's prescribing these hormones to you to work with this very carefully. And the very first thing I would suggest is that the experiment I would run. We're getting an echo. I'm not sure what's happening. Can you hear me? Can you hear me, Carolyn?
Now I can. Yes.
You may have to mute, Carolyn. We're getting an echo. So the very first thing I would do, for example, is I would assess how high those liver enzymes are. I would follow those liver enzymes by blood tests weekly or every other week. And I would see if they're rising. And if they were rising, or if they were a little high to begin with, I would run an experiment of stopping the hormones and seeing if they decline. That doesn't mean I'm suggesting a permanent stoppage of the hormones. I'm suggesting to try and discover, are the hormones being more than the liver is capable of handling? And if it turned out that the liver enzymes came down, and the next thing I would do, and this is in the realm of a functional medicine physician, I would do things to support the liver. And the very first thing I would do is a very extensive and detailed, rigorous review of the diet. Is there anything in the diet that is hurting that liver on an ongoing basis? Are there any medications this patient is taking that is hurting that liver, that is challenging that liver? And the next thing I would do is I would do a state-of-the-art stool test to see if there's any critters in the gut or issues in the intestinal tract, including something called leaky gut, that could make even food a problem to the liver.
Right.
Do that because the liver receives the downstream from the gut via lymphatic channels. And if there's yucky things going on in the gut, the liver is there to protect the rest of the body from those things that get absorbed from the gut. And I would also examine digestion and really enhance digestion, because you can alleviate some of the challenge to the liver if you properly and completely digest your food, which adults don't do. And I'm venturing into the world of functional medicine. And I would also do a liver cleanse, and I'm not going to go into the details of that. I would do lots of things to help that liver heal. Because if something's pushing up liver enzymes, even though in traditional medicine calls those liver function tests, those are not liver function tests. When those enzymes go up, those liver cells are hurting. There's actual injury to those liver cells. So, you take your time and you do your due diligence, and healing is possible, and it's not the end of the world. It's you figure these things out, but you do so with people who are really skilled at that. And with that, I'm going to bring today to completion.
Okay.
And, oh my God, it's Christmas. And to all of you out there, let me tell you what I think of Christmas.
Okay.
Constantly being conscious of the gift we receive during Christmas, which is movement towards unconditional love.
Absolutely.
And there's magic. There's special energy in the air. I'm tearing up when I'm thinking about it. And to all of you out there that we're participating with, and to you, Carolyn Shapiro, Merry Christmas.
Merry Christmas to you, Dr. Rosensweet. You've been amazing in teaching me so much, and I'm able to receive the constructive criticism that you so gently give me, and I love it. I do, and I'm honored to receive the constructive criticism I get, because how else are you gonna learn, Merry Christmas. Christmas is a wonderful time. And on top of that, and I'll let you go after this, now we're in the age of Aquarius, right? So it's Jupiter's aligning with Saturn, and all the first time in 800 years, and all this wonderful stuff too that's happening astrologically and astronomically too. So it's a great time right now, I think. Yeah?
Yes, it is. And once again, Merry Christmas. I'm going to sign off.
And thank you to all the ladies. Hi, Jerry, and Facebook user Joanne, Krishna, Joanne, and Erica. To everybody, happy, ho, ho, ho. Right?
Bye-bye, Carolyn.
Bye-bye, David. Good to see you. Love to everybody.